Dr. Vim Patel is a board-certified physician specializing in concierge medicine. And he's going to show us around this state-of-the-art facility, which is taking concierge medicine to a whole new level. Thanks for having us.
Thank you, Kimberly. Thank you, Ethan.
Tell us how the whole idea of Evolve came about. It had to do with your previous medical experience, correct?
Yeah, my previous manifestation, I was a hospitalist doc, which in essence is a doctor that only works in the hospital. Only if you were really sick and needed to be admitted into the hospital would you ever encounter a doctor like myself.
This high-pressure environment often leads to burnout and even the best of physicians. Dr. Patel and his wife Chithra broke free of the traditional mold of medicine by designing a patient-centered practice, focusing on achieving good health and overall happiness.
So we have created Evolve Personal Health for our South Tampa population, simply to improve and be better.
So when you talk about being better, obviously you have this structured quite differently than the background you came from. Why don't you kind of describe what a typical day would be like for your patients?
This is patient-centric, first of all. So our patients have full access, complete autonomy to schedule, to visit. We have unlimited visits. They can come in as much or as little as they want. We decided to look at the patient from a multi-dimensional angle.
Their office has several departments that focus on different aspects of the patient's life: physical, nutritional, and introspective.
Dr. Patel is not only a medical doctor, but also a personal fitness trainer and health coach who will even visit a patient at their job to assess how they can strengthen physical ailments and limitations.
One of the other important aspects that we do here is we understand that it's not just physical manifestations, but disease and health can come about from the daily food that we eat here. So food is medicine.
Nutritionist Don Hans will not only create a balanced menu for each patient's individual needs, but also will act as a support system in times of crisis.
We have identified that we certainly need constant contact. If you're there and there is a cheesecake in front of you, ooh, that's tempting.
Yes.
And it's going to be difficult for you not to eat that cheesecake. But we have Dawn here who can simply text you in moments of crisis. Don't eat that cheesecake. So we have constant communication with our patients. So in those moments that you certainly do need somebody to tell you, please don't have that cheesecake, Dawn is right there sitting next to you and saying,
she can be your conscience.
Absolutely.
It's like having a sponsor in AA, you know?
Yes.
When you're feeling weak, you gotta call your sponsor, and Dawn's the food sponsor.
We have our 12-step cheesecake program that we have here.
I like it.
Dawn's approach is a more whole foods-based diet, which sustains good health over the long term.
And one of the keystones of the practice here, and which is not done in, I dare say, any medical practice, is our introspective counseling.
Chithra Prasad Patel is a certified life coach who helps patients overcome mental obstacles or daily pressures that impede their overall happiness.
Why couldn't we stop smoking, or what other pressures, work, life, that cause a blockage in us, that make us sick, that sometimes manifest into physical ailments? We try to address those problems and help our patients move towards better health.
Wow, so getting the stumbling blocks out of the way so you can have a more healthy existence.
We think that is not addressed in our current state of medicine, and we think that is such a key factor in getting our patients healthy.
We speak with introspective counselor Chithra Prasad Patel.
So we've taken two concepts, blended them together: meditation and life coaching and executive coaching. And together, this is what we call introspective counseling,
which is identifying and addressing areas of anxiety, depression, or stress.
Now, is this similar to a typical therapy, a therapist that you would go see? How is it different?
Well, life coaching in itself is different in that we're not really addressing the past of why things are the way that they are. We're looking at your current resources and saying, okay, well, what can we do to take this and move further with it? And it is very solution-based, and there's accountability. So it's like, you come in here with a goal, you have homework, you meet it, and it's an ongoing relationship. And we put together your individual program, identify what your individual formula for happiness is, and then take the steps to work towards it. Our methodology really is having personal relationships. And we're seeing that people don't come here and have any sense of formality. It's just like,
they're visiting their friends.
Yes.
When you think of state-of-the-art, you tend to think of incredible technology. However, Evolve took a different approach, modernizing their environment by eliminating much of the electrical pollution we encounter daily, by filtering outlets and having all computers and devices hardwired with no running Wi-Fi or Bluetooth.
For us, state-of-the-art is more forward-thinking, progressive, modern, and we've designed it as such.
Very relaxing atmosphere.
Yeah, wasn't there also a little bit of modeling it after, say, museums or gardens and things like that?
Oh, yes, garden spaces. The Rothko Chapel was definitely an inspiration. There are places where we've been to that have just exuded this sense of calm. And so when people come here, one of the most amazing things is that they all are thinking about being better.
Unlike a traditional doctor's office, patients at Evolve find the atmosphere welcoming and a perfect place to disengage, stopping in for lunch or just to relax and escape the daily grind. They also have a massage therapist.
I also understand here at Evolve, you're also very heavily influenced in the community.
We create a community here, like, as we were talking about the Vim Chi concept, we have a scoring system, and the idea really is that our members are part of a community. They can see their different scores, they can talk to each other. It really becomes a motivating tool.
Evolve is also heavily involved in the Red Sand Project, which supports activist artwork created to raise awareness of human trafficking and modern-day slavery.
The private sector can do so much in the community, and if we encourage our members, each decision that they make, each sort of move in that direction can create real, tangible social change.
The Vim Chi philosophy employed at Evolve was created by the Patels from a play on their names.
There's almost sort of an Eastern philosophy to what you do here.
Absolutely.
You call it the Vim Chi philosophy. Now, is that because your name is Vim and it's like a Tai Chi, it's a play on that, or is that an actual thing, or is it your own philosophy? Tell us a little bit about that.
Sure, it is a philosophy that we came up with. Now, it's a play on words. My name is Vim and my wife's name is Chithra, but Chi, and it's also the physical vitality, which is Vim, and the life force, which is the Chi, and we put those together. It's a philosophy where we take everything that's external, the physical, the ailments, and those things that are internal, and we try to have a good unity of both of them.
Evolve also hosts yoga classes and meditation sessions.
Anything that our patients kind of bring to us as to what they would like to see or what they would like to kind of explore.
Offering classes is just one more way they get involved with the community.
So we try to get our patients to be engaged, and if that means group classes to do yoga, great.
Dr. Patel even hosts and participates in free monthly 5K runs.
A healthy individual going out and touching a community makes the community that much better.
Unlike most traditional practices at Evolve, patients have full access to the facility and can schedule visits whenever they like.
Is this a membership based fee? How
Absolutely.
Is this structured?
We do not accept insurance, and we have a monthly membership fee. We deliberately keep it as a low volume practice so we can have intimate relationships with all of our members and patients here. The approach that any client or member wants to come with, be it counseling sessions or a doctor or participate in the runs or yoga, we certainly have different pricing structures where individuals can come and take a look and adjust to where their financial state is.
Dr. Patel's goal in opening Evolve was to remove all the red tape insurance companies tend to wrap around healthcare and really focus on building a relationship between the doctor and patient.
And the whole concierge idea is not necessarily new, but it's relatively new to a lot of people. We've covered it pretty extensively on the show, Kimberly.
Yes.
And I think that it's just such a novel, great idea to bring back that relationship between the doctor and the patient, because you're not focused on seeing as many patients as possible because you got to give a percentage to insurance. You can tone it down, see, a handful of people, they pay a monthly membership fee, and it really brings back that doctor-patient relationship.
Right, so we deliberately try to streamline the process. We find a lot of hoops we have to jump through, and certainly I did when I was a doctor that did accept insurance. There are certain limitations and certain restrictions, even on the patient side. So we tried to make that navigation of healthcare much easier for you.
Much more
and hopefully
accessible.
cheaper. Yes.
With their non-traditional approach to medicine, Evolve Personal Health continues to reinvent our perceptions of what a doctor-patient relationship should be. It's a great thing you have going here at Evolve Personal Health. Thank you so much for everything you do, Dr. Vim Patel.
It's our pleasure. Thank you, Kimberly. Thank you, Ethan.